Good afternoon, guys. Let's welcome to Mug-Up Day 3 series. Today we are going to discuss about types of shock. In the types of shock, we will be facing the three main problems. One is heart will not work properly, and second one is any changes in the fluid status, and the third one is low fluid. Okay, and when it comes to heart doesn't work properly, it's a cardiogenic shock. Heart is a cardiogenic shock. And when it comes to the low fluid, it's an hypovolemic shock. Low fluid volume in our body is like a hypovolemic shock. Coming to the change in the fluid status, it's a distributive shock. In distributive shock, we have three underlying problems, namely one organ function. It will be like any one of our body's organ function will be failing due to an infection, and second one will be loss of any sympathetic zone, and third one will be anaphylaxis. Okay, any abnormal activity in our organ function due to an infection, that is called as the vasodilation, septic shock. Okay, then any loss of sympathetic tone is the neurogenic shock, and in the name of anaphylaxis only we can find it out that is an anaphylactic shock. All the three, the distributive shock will be giving increases in the vasodilation. Indirectly, which one was giving the vasodilation is the loss of sympathetic tone, which is a neurogenic shock. Increases the vasoconstriction plus, and additionally increases the vasodilation also. Okay, now let's explaining you about the cardiogenic shock, hypovolemic shock, septic shock, neurogenic shock, and the anaphylactic shock. Okay, the first one is the cardiogenic shock. Heart which is inability to pump enough the blood. Heart which it is inability to pump the enough blood is the cardiogenic shock. In the cardiogenic shock, there will be, you can be finding that the treatment will be like, I will be explaining about the treatment also at the end of the part. Okay, now in the hypovolemic shock, there will be any fluid losses, bleeding or any fluid losses. The hypovolemic shock is of about the two types, hemorrhagic and the non-hemorrhagic. So one is hemorrhagic and second one is non-hemorrhagic. Okay, so hemorrhagic is the bleeding. So for example, if you have any accident or any fluid any bleeding in the spleen regions, for example any bleeding in the splenic organ, okay, that is called as bleeding. And second one will be like after any trauma accidents, we will be having lot of bleeding, so the patient can go immediately to the hypovolemic shock trauma. And third one will be like postpartum hemorrhage. After the postpartum, the patient can go to the hemorrhagic hypovolemic shock. So when it comes to the non-hemorrhagic, so burns, second will be diarrhea, third will be salt wasting. Okay, these are the things of about the hypovolemic shock. So treatment will be given later. And the septic shock. So when it comes to the sepsis shock, we can understand that there is a severe complication and of the sepsis. So usually the patient will be noted with fever. Okay, let me erase this and I will write it for you. So the primary will be like fever. This is the initial stage. Okay, the primary one. And the secondary one, fever, and plus the patient will be having a hypotension, like the fever will be maintained in the 99.0 to 100.9. It will be maintained in this range for the septic shock, secondary septic shock. Okay, the initial stage will be like warm and flushed. Here patient will be looking like a warm and flushed. Okay, then the treatment will be given later. And the neurogenic shock. Neurogenic shock will be like any damages due to the nervous system. In the nervous system there will be a damage. So in that and all, the patient will be getting a neurogenic shock. For example, in the spinal cord regions due to an accident also, any damages, even it can be due to infection also. And coming to the anaphylactic shock. Anaphylactic shock is like any type of severe allergic reaction. Okay, severe allergic reaction will be anaphylactic shock. Then let's come to the type of cardiogenic shock, their cardiac output. In the simple way, we should get to understand recording this. Okay, cardiac output, heart rate, and central venous pressure, pulmonary capillary wedge pressure, systematic vascular resistance, and O2 saturation. These are the things we will be noticing in the to find out whether that patient is having which type of shock. Most common is the septic shock, and hypovolemic shock is the second most common. Okay, goes to the cardiogenic shock. The output, let's come to the disruptive shock of the neurogenic shock. Okay, in neurogenic shock, everything is low. Low cardiac output, low heart rate, low central venous pressure, and low pulmonary capillary wedge pressure, and systematic vascular resistance will be low, and oxygen also, O2 saturation will be also low. Okay, so easiest way, the central venous pressure, either it can be normal or low in all the cases. Okay, it can be normal also in all the cases. In all the cases, you can mention it as a normal also, no problem. Then it goes back to the, let's come to septic shock and the anaphylactic shock. We will be seeing that later. Okay, or let's come to the anaphylactic shock. In anaphylactic shock, cardiac output will be increased, heart rate will be increased, but all other central venous pressure will be decreasing. Pulmonary capillary pressure will, pulmonary capillary wedge pressure, this is PCWP, decrease, and systematic vascular resistance will be decreased. Oxygen saturation will be also decreased. Okay, so now we will be going to the septic shock. In septic shock, what will be happening? Septic shock, cardiac output will be increased, so the fluid will be going so faster to get it out with the infectious rate to pass it through the urine, that we will our heart will do, our organ will do anyhow. Okay, increases in the heart rate also. Capillary wedge pressure will be decreased, the capillary venous pressure will be decreased, and pulmonary capillary wedge pressure, that also will be decreased. Systematic vascular resistance also will be decreased. And that's the only thing here we will be noticing, that the oxygen saturation will be increased. I will say to you recording this later. And coming to the hypovolemic shock and then cardiogenic shock. In hypovolemic shock, the fluid is very less, so decrease in output, increases in the heart rate, increases in the heart rate. It is trying to compensate, so it is trying to increase. And in central venous pressure, it has been decreased. Pulmonary wedge capillary pressure will be decreased, and systematic vascular resistance has been increased. Again, the oxygen saturation will be reduced. Okay, then the cardiogenic shock. Cardiogenic shock is decreases in the cardiac output, increases in the heart rate, central venous pressure will be increased, pulmonary capillary wedge pressure will be increased, and systematic vascular resistance will be increased. Oxygen saturation will be decreased. Here you can notice one thing. Now you can see in the distributive shock, the septic shock, neurogenic shock, and the anaphylactic shock. In this we can notice that all the three of the central venous pressure, pulmonary capillary wedge pressure, central vascular resistance will be decreased. Okay, and coming to the neurogenic shock. it is all will be decreased in the neurogenic shock. In the heart rate, except neurogenic shock, everything will be increasing. In the heart rate, you can notice, except the neurogenic shock, it has been increased. Coming to the septic shock, everything will be decreased in the oxygen saturation, but in the septic shock, the oxygen saturation will be increased. Okay, that's the easier way we can understand so nicely. Now let's go. Okay, see, some people are going to see with the quick method in the OPD basis. We should not to find suddenly and all, right. The patient is coming and suddenly we have to check it over and we have to get admit a patient or not. We have to discuss if it is everything we should have to find out. So in the emergency time period, like in the first calculation period or the primary set of forming period, we will be seeing the BP. In cardiogenic shock, the BP will be decreased, heart rate will be increased, respiratory rate will be increased, and the patient's urine level will be decreased, oliguria, and the patient will be in the confusional state. In the hypovolemic state, the BP will be decreased, heart rate will be increased, respiratory rate will be increased, and urine will be decreased. This is the early stage. What is the late stage? Late stage is septic shock. Okay, here the BP will be decreased, pulse rate will be increased, respiratory rate will be increased, and urine rate also will be decreased, guys. Late stage. Okay, and in the neurogenic shock, decrease in BP, decrease in pulse rate, increases in the respiratory rate, and decreases in the urine. Then comes to the anaphylactic shock, which was the allergic IgE type 4 hypersensitivity reaction. Okay, yes guys, type 1, sorry, it is a type 1 hypersensitivity reaction. I will write it down here, type 1. Okay, and at the end also I will write it here, type 1. The anaphylactic shock, BP will be decreased, the pulse rate will be increased. Here in the anaphylactic shock, it will be decreased, the patient will be having a shortness of breath. Okay, sorry, having a shortness of breath. Decreases in the respiratory rate, patient is having a shortness of breath, and the patient will be having bronchoconstriction also. Urine will be also decreased. Coming back for the treatment, if we are finding out that the patient is having a cardiogenic shock, hypovolemic shock, and septic shock, neurogenic shock, and anaphylactic shock. So cardiogenic shock, the treatment will be like, we will be giving IV fluids, oxygen therapy, IV fluids, O2 therapy, vasopressors and inotropes. Let's go to the hypovolemic shock. In the hypovolemic, what we will do, the patient here also will be in the confusion only, guys. So IV fluids, O2 therapy, and blood transfusion if necessary. Transfusion on if it is necessary, SOS basis. And the septic shock, the treatment will be like IV fluids, antibiotics. We will be giving solve out the infections, antibiotics, and if it is necessary we have to give oxygen therapy. Actually we will be giving the oxygen therapy. For the neurogenic shock, it will be increases in the damage to the nervous system. How we will be finding for the neurogenic shock? The patient will be noticed with the dry or warm skin, guys. Okay, so the treatment will be like IV fluids, O2 therapy. We will be giving atropine also. Atropine, if patient is bradycardic, we will be giving the atropine for the neurogenic shock if the patient is having bradycardic. And the anaphylactic shock. In the anaphylactic shock, it is a IgE and type 1 hypersensitivity. Okay, type 1 hypersensitivity. What we will be giving in the anaphylactic shock? We will be giving the treatment of injection of HCOT, hydrocortisone, and O2 therapy, IV epinephrine. Okay, and albuterol, some type of antihistaminics also, histamine drugs also we will be giving. Okay, mainly in anaphylactic shock we will not give what? Norepinephrine. In all others we will give norepinephrine. All